So good evening, everyone. My name is Reena Pereira, and on behalf of Mrs. Lorna Lobo, Secretary of the Women's Commission of Bangalore and the Ascension Women's Cell, I extend a warm welcome to all of you. This webinar is an advocacy platform that brings together the voices of doctors, environmentalists, students, and individuals to promote sustainable menstrual health and hygiene for all women and young girls. And I would like to start with a short introduction to the Women's Commission. The Women's Commission of Bangalore Archdiocese enables and empowers women and girl children to lead an enriched and holistic life. We have around 125 dedicated members representing various zones in Bangalore, working at the grassroots level. Pleased to inform you that during the pandemic, we had 2 mega outreach programs wherein we distributed masks, essential food supplies, clothing, amongst others. We also distributed 40 tablets to poor girl children for their online education. The Ascension Women's Cell that is hosting this webinar today has been operational for more than a year under the banner of the Women's Commission and has been active in conducting similar initiatives relating to women empowerment and uplifting the girl child. At this exclusive webinar, we are pleased to focus on a topic that is pertinent to every girl and woman, and we are honored to have an eminent panel in our midst. We would have liked the Archbishop to open the event today, and he would be joining us soon.
Get the video.
In the meantime, Lorna, could you please begin with a short opening prayer, please?
In the name of the Father, and of the Son, and of the Holy Spirit. Amen. God, our loving Father, we thank you for the gift of this beautiful day, for the gift of life, for the gift of family and friends and loved ones. We ask you to be with us this evening, guide our host, our delegates, and our participants through this program. May it inspire us and the people to whom we will be talking to and spreading the good news for the use of the sustainable cloth, menstrual cups, and the cloth pads. Help us to touch the lives of the poor, the downtrodden women and girls of our society. Bless this evening's webinar and let it be a happy and fruitful one. We ask this through Christ our Lord. Amen. In the name of the Father, and the Son, and the Holy Spirit. Amen.
Thank you, Lorna. When we have the Archbishop logging on, we would have him address us. Until then, we now come to the crux of the program, the panel discussion. To introduce our distinguished speakers to you, I call on Iona Mesquita, the Joint Secretary, Ascension Women's Cell. Iona, over to you.
Thank you, Reena. It gives me great pleasure to welcome and introduce our experts for this webinar. We start with our main speaker, Dr. Meenakshi Bharath. Dr. Meenakshi has been a doctor gynecologist for 35 years and a fertility expert for 25 years now. She is also a green campaigner, an advocate for Clean India, and a strident voice for garbage segregation, reduction, and recycling. Prevention is better than cure has always been her mantra, and knowing that garbage produces so many diseases made her take up this not so glamorous task. From garbage segregation to composting, to growing vegetables on her terrace, to having a waste-free wedding for her children, she has done all that one can do individually to spread this message. Having retired from active medical practice, she spends her time spreading the message of sustainable living. Our next panelist, Nirmala Gowda Nayak, is a graduate in psychology and a certified counselor. She's a former beauty pageant winner and an expert yoga practitioner. A blogger and a stylist, she believes in sustainable living. She has been actively involved in teaching yoga, telling stories, and offering counseling in a number of homes, including the Police Commissioner's Office. Ex-President of the CSB, Community Services of Bangalore, and President and founding member of World of Women, she has been involved in educating rural women about menstruation and creating awareness about menstrual health issues through yoga, sustainable living, food, and emotional well-being. Our third panelist, Shilpa Spoorthy, is an architect by profession and a student mentor by choice. She is closely associated with students and working on empowering them on United Nations Sustainable Development Goals. She is the former secretary of the Inner Wheel Club of Bangalore Blossoms and has worked on many environmental and social developmental projects, including distributing sustainable menstrual products to all the female police personnel of our city, the garbage collectors, and ASHA workers. Our student panelists, Olga, Roshni Printer, and Syed Wahaj Hassan, are students of ISC at Joseph's Boys High School, who interestingly did an assignment on the topic. Both have put in a lot of research on the topic and have ideas to use them to start an enterprise. Our moderator for today, familiar to most of us, is none other than Dr. Marianne De Nazareth, an award-winning journalist with a PhD in journalism. She is presently a full-time freelance journalist, having worked with Deccan Herald for years. She writes on a variety of environmental and gender issues for a host of Indian and international publications, with a strong focus on conservation, species loss, and gender issues. Dr. Nazareth has 6 books under her belt, with a 7th in the works. She has been adjunct faculty at several colleges in the city and has written several papers during her PhD studies. With this, I hand you all over to Dr. Marianne De Nazareth for the panel discussion. Over to you, Marianne.
Thank you, Iona, for that very warm welcome and introduction of our panelists of today. For billions of women and girls worldwide, menstruation is a monthly reality. And yet in India, women still face serious challenges when it comes to managing their periods. Myths, stigma, and harmful gender norms around menstruation exacerbate the difficulties for girls and women across the country. Period shame is rooted in gender inequality, cultural and religious traditions around periods, which are often derived from discriminatory patriarchal norms about a girl's status and place in society. As a result, girls and women are often expected to refrain from normal activities such as bathing or cooking, and may even be banished from the home during their periods. These restrictions and negative attitudes towards menstruation affect a girl's self-esteem. This webinar is being held in the hope that we can educate young people about periods and talk about them in a shame-free and sustainable way. Through the outreach program of the Women's Commission Group, to distribute menstrual hygiene materials and teach girls how to manage their periods sustainably so they feel confident and stay in school. By improving menstrual health and tackling period shame, we can improve girls' attendance and performance at school, break down taboos and misconceptions around menstruation, raise girls' self-esteem, and enable girls to fully participate in all aspects of society. After all, it's the woman who is the heart of the family. So let's get cracking and pick our panelists' brains about the marvelous work they have been doing in the field of sustainable menstrual hygiene and health. The focus of today is educating us women to shift to the menstrual cup and reusable cloth napkins rather than use the regular commercially sold sanitary napkins that do not decompose. My first question goes to Dr. Meenakshi Bharath, our chief speaker for this evening. You are an alumnus of St. John's Medical College, Bangalore, and your name immediately has people saying, Dr. Meenakshi, she's doing yeoman service in the field of menstrual hygiene. She is the best person to speak on this topic. Please do give our viewers, Doctor, pointers on the new developments in menstrual hygiene and why it is important for women to shift to the sustainable menstrual cup and reusable cloth napkins. After all, this webinar is to encourage more women to embrace sustainable menstrual practices.
Thank you, Marianne. Over the last 30 years, we've undergone a sea change in technology. I remember the time where to make a call to my parents was so difficult. Today, not only can I make a call, I can do a video call and I don't miss being in the same house. All of us have adapted to the new technologies that have come into being. In a similar fashion, periods have also undergone a sea change where technology has brought in new solutions for our periods. And these new solutions are what we must all adapt to, like we have adapted to our mobile phone, like we have adapted to the power steering, like we have adapted to so many things, including this Zoom call. 2 years ago, before the pandemic, we wouldn't have thought it was possible that I would be sitting in my home and all of you in your homes, and we could be actually talking to each other. So the technology that has come is this new little menstrual cup that you see in my hand. This is made of medical grade silicone, similar to all the various devices that we use in medicine, the heart stent, the catheters, various devices that we use. This is 15 grams and this can be used for 10 years. It is so convenient, it is so cost effective, and it creates no garbage. So it's a no rash, no cash, no trash program. Why must women take to this? Like you have taken to the mobile phone, you need to take up to newer technologies, and you need to take it purely because your periods become such a wonderful event, not an event that you're going to say, oh my God, tomorrow my periods are coming and I'm going to be miserable. With this menstrual cup, you're actually going to say, wow, my periods, they're coming and I'm going to use the cup and I won't even know that my periods are there. That is what you need to do. Don't miss out on it. I missed out on it because I am obviously menopausal, but this was not available to me 13 years ago. Now, my mission is to make every woman aware that there is such a concept and that you need to use it. Yes, of course, you have to learn to use it. Anything you have to learn. To walk, you have to learn. To use this device, you have to learn. So you will learn this. How long will it take? It will take you 2 to 3 or 4 days. Out of 65 days in a year that you're going to have your periods, it'll take maybe 3 or 4 days. And a few people may take a little longer. But once you have learnt it, you will forever not go back to this disposable sanitary napkin. It is that wonderful. And you actually will even forget your own periods. Isn't that wonderful? I think all women must adapt to this. And 18 to 50, 32 years, you can use 3 such cups. It means you save enormous amounts of money, you save all the trash that's going to the landfill, and you have the most comfortable periods. Health, wealth, and environment all taken care of.
My second question to you is, Could you give us an idea of what are the kind of massive figures of menstrual waste we are looking at going into our landfills, and how the menstrual cup or the cloth napkins can make a dent in these figures? Please.
Sure. So what happens that each woman would use anything between 12 and 15 pads per month, which means anything between 150 to 180 pads a year. Now, what this cup will do is replace 1,800 pads from going to the landfill per woman. And what this cloth pad will do is replace 360 disposable sanitary napkins from going to the landfill. Now, Bangalore produces 100,000 kgs of sanitary waste a day. So imagine if each one of you will take to this menstrual cup because you're 18 years plus or you are married, then just imagine how much of waste you are saving from going to the landfill. And what is the waste that goes to the landfill? It eventually, when it rains, all of it seeps down into the ground, goes into the underground water and comes back up to you from your borewell, and then that's the water you're drinking. So you're contaminating the soil, you're contaminating your water, and when you burn this garbage, you're contaminating the air. With this menstrual cup, which is 15 grams of medical grade silicone, at the end of 10 years, you may want to discard this, but I wouldn't discard it. I would keep it as a sample and show every woman that I have used this cup for 10 years. Just look at it, how wonderful it is. It is the same shape, it hasn't changed, and it has taken so much of my periods. And when you use this cup, you actually realize, oh my God, I'm not bleeding Ganga Jamuna. I am just bleeding so little. So, all these myths go away. And then when I use this cup, I no more have white discharge. I no more have abdominal pain, or that gets reduced. And I am free to do everything from trekking the Himalayas to swimming in the wonderful seas and oceans that we have, to cycling everywhere and not even knowing that I am having my periods, not even feeling that I'm having my periods. So why, ladies, must you miss it out? And why, gentlemen, must you not give this as a gift to your wife, your sister, your mother, and your daughter-in-law too? Don't forget.
That's true. I agree. And my third question to you is, being a science and environment journalist, I took a class on menstrual hygiene with the PG girls of Mount Carmel and Jyoti Nivas. In this day and age, many young women from educated families are still being told that traditional beliefs dictate that they are unclean. What is your comments on that?
So a lot of the backlog that we are carrying from many years ago is what dictates this feeling that it is unhygienic. But if you actually look at it, periods for women is like beards that men grow.
Yes.
It is the same. It grows every day. You have to shave. If you don't shave, you have a fuzzy beard. The same way women need to bleed because the uterus undergoes a cycle. And this is normal for us. We will have 400 periods in our lifetime. And those 18 to 27, 9 months, we will not get our periods when we are pregnant. And that's all it is. So it's nothing that is unhygienic. It is just a normal discharge. If we will keep ourselves clean, then there is absolutely no problem. So you need to keep yourself clean. And this menstrual cup is so wonderful that you don't even get the stink of the disposable sanitary napkin. So there is no smell also. Your bathroom will be absolutely spotlessly clean, and no aroma of the periods going on. And then your dog, because the dog cannot smell the blood, will not be chasing you around saying, she's having a periods. What I need to follow my mistress. So it's so wonderful. So that's what you need to understand, that you can use the newer solutions that are available for your periods. And this is for women 18. What happens to the younger girls who still don't know their body well enough? Tell them to use a cloth pad with a leak-proof material at the back, and this will not allow her uniform or her clothes to stain. And to wash this is very simple. Just soak it in a little bit of water, cold water, and squeeze it out, wash it, and hang it out in the sun. So everybody, you have to, and I have to teach my girls to take care of their pads. You can't be sending your little girl who will become a big girl very soon without teaching her how to take care of herself and all the other things that you want. Teach her to bake, teach her to cook, teach her to take care of herself and everybody in the house. So it is how we teach our children that they will learn, yes, I can manage my pads. Otherwise, we are throwing this and creating enormous problems for the environment. And also, so much money lost. One period is 100 to 150 rupees. If you use this cloth pad, then you will be spending 400 rupees upfront or 600 rupees upfront, but this will last you 3 years. So no garbage. And if you are buying a cup, this may be 1,000 rupees, but divided by 10 years, it's 100 rupees. And what will it be per month? 8 rupees. Just imagine, you have saved so much of money. So the concept of period poverty, where women do not have money to buy what is touted as the hygienic product, is no more there. This is not hygienic. This is hygienic, and this is hygienic. It saves you money, saves you trash, and ever so comfortable.
So, Doctor, there are many young and unmarried women who shy away from using the tampon, and they feel it's invasive. How much more difficult is it to convince them to use the menstrual cup?
Actually, if one friend of that girl will say that I have used it and I find it very comfortable, then the peer pressure, the positive peer pressure that comes from her friend, and there are many young women who are not necessarily sexually active, who can use this without any problems. So you are saying, or we are all worried that our hymen will rupture.
Yes.
Now the hymen doesn't rupture. The hymen already has a hole in it, and the hymen is really small, not even this big. It is 1 to 1.5 centimeters by 1 to 1.5 centimeters with a hole that allows your blood to come down even before you get sexually active. So this is there for you, and this hole will only expand a little bit when you use the menstrual cup. Now, if you're cycling, if you're doing long jump, if you're playing basketball, if you're swimming, then this hole just becomes a little looser. So truly, it's not a problem. So the fear is in the mind, the fear is not there in the bottom. And this is where you're going to put it. You're going to put it into your vagina. So learn the techniques. That is, if you are wanting to do it. But I would always tell the young girl that make your mother use it first. If your mother uses it, then she will have the confidence to tell you, I'm using it. It is so comfortable. I want you, my child, to also use it.
Thank you, Doctor. Thank you so much for that, all your insights and your experience in this. And I hope all our viewers will be able to pick up a lot, especially the younger ones who have never tried using a menstrual cup. So I move on to Shilpa, who, along with her Inner Wheel Club, has realized the environmental impact of sanitary napkins that the world has been using and which do not decompose. Could you tell us about your drive to see that during your tenure as secretary, you gifted economically challenged women sets of cloth sanitary napkins which are reusable, and why?
Hi, Marianne, and thank you for having me over here. Why we started using, why we started this initiative was because the project, what the theme given to us last year was hope, was that is health and hygiene, O for old age and orphanage, P for patriotism, and E for environment. So we had to kind of do projects pertaining to this. And this distribution of menstrual cups and reusable sanitary napkins covered all the four categories of health hope, that is health and hygiene automatically gets covered, old age and orphanage, where we went and gave these sanitary napkins to the orphans in a few orphanages. uh, Patriotism, when we say patriotism, it was more to do with made in India products. So again, we had sanitary napkins which were made in Bangalore itself, and we distributed it. And by default, environment as well gets covered when we introduce sanitary napkins to them. So this is the reason why we started. And our journey began with two 17-year-old girls who were, one of the girls was the daughter of our club member, and they came and told us, they introduced us, they gave a small talk on reusable menstrual napkins and cups, and which kind of like, intrigued us. And we said, okay, these are two 17-year-olds and we are all above 40, and we were not even aware of this. At least what we did was like, let's start using it ourselves before we even kind of introduce it to others. So a few members, we in fact kind of attended, in fact, Dr. Meenakshi Bharath's webinars as well during those times. And we said, okay, we were kind of convinced, like, when 17-year-old girls can use it and they're comfortable and they're so confident with regard to this, why can't we try it out? So we few members started using cups. We tried all the ones with the stem, without the stem. Then a few of us, we introduced sanitary napkins for the younger, the members' daughters. And when we started using the cup, we were really, really comfortable, and it was a huge change. And that is when we said, okay, let's introduce this to the police personnel. And that's when Mrs. Nisha James, admin of the DC, Commissioner of Admin of Bangalore City Police, she came kind of, encouraged us, and she said, why you want to give it? We thought we'll give it only the traffic police women. He said, no, let's do it to all the police personnel of the Bangalore City Police. And that's when we had webinars. So we kind of introduced this cups to the nodal officers. We had webinars under the nodal officers. We had 10 to 12 police stations. So we had taken in community center where, all the police women would come, and we would give them a demonstration along with the gynecologist Dr. Meenakshi Bharath, and we had an in-house gynecologist, Dr. Nishita. So we kind of said, okay, let's do this. We gave a live demo, showed them how it is used, address their questions. We had introduced a WhatsApp group where, they can ask us questions when they're, using it. And that's how we started with the police personnel, and we distributed to 2,000 plus police personnel. And along with that, we also went to Women and Child Welfare Department, where there are mentally ill women, and there are girls who are housed over there, and we introduced it to the staff over there. So when we introduced to the staff, they said, no, not everybody can use cups, so let's kind of give them the sanitary napkins. So we gave them reusable sanitary napkins. And then apart from that, we also gave sanitary napkins to the BMTC bus, BMTC and KSRTC women staff of the BMTC and KSRTC bus, and of course to the HIV positive children. Thanks to your team, they gave us the opportunity to give it to Dina Nilaya, where HIV positive girls are housed. So yeah, that's how our journey started, and we were very happy to kind of spread this message, not just to the few women over here, which inspired the Stonehill students to raise funds, and they also gave us some almost 60,000 rupees, where they raised the funds for us. So because of which we were able to donate sanitary napkins to Paura Karmikas and Asha workers. So that was our journey, and that's how we started with this particular initiative.
Thank you, Shilpa. Thank you so much. That's really been an amazing journey, and you have touched so many women's lives. Now it's time.
Marianne, at this point of time, since I had no option to mention it before, And since Shilpa mentioned it now, I think this is the right time to mention. We would screen share it later. But Inner Wheel Club of Bangalore Blossoms has donated 200 cloth reusable napkins to Dina Nilaya HIV Center, Kothanur, as Shilpa just mentioned. We have also received monetary donations amounting to rupees 25,000. So this was something that I would have mentioned earlier, and the Archbishop of Bangalore cannot join us now. He had technical issues at the start and has conveyed his wishes and blessings to all of us for this program. Thank you. Marianne, over to you.
Thank you, Reena. And now it's Nirmala's turn to tell us about her Kannada booklet. Nirmala will be sharing the screen with me because she's had a bit of technical issues, which is fine. She's done a Kannada booklet. Can you tell us about this booklet and the illustrations and how it has become reader friendly? And how did you go about making the booklet?
Rutu Chakra. The name itself says there is a deep connection between the seasons and the menstrual cycle. This book also, highlights three important, issues. One is the gender issue, the second one is the health issue, and the third one is the environmental issue. Gender issue. Men are the policy makers from the panchayat level to the constitution level. So it's very important to include them in this journey so that they can bring changes, in removing all these taboos and stigmas for a healthier society. And the second one, health issue. See, yoga, food, talking about the food, regional and the seasonal, the food and the emotional well-being, all three put together. If a woman practices all this in a very holistic way, she's going to enjoy menstrual health in a better way. And the third one, environmental issue. We educate our girls and women wherever we go to be responsible when they're using their regular sanitary pads, using also disposing, and also encourage them and educate them to go for more and more sustainable products or the eco-friendly products. Thank you.
Yes. And Nirmala, you're a yoga expert. It is a known fact that yoga helps during menstruation. Please could you tell our viewers which asanas can be done to help control menstrual pain? Can we practice them during menstruation? And what is the duration of each pose?
Thank you, Marianne. That's a very good question. Many of us here always have a doubtful about whether we need to practice during menstruation or not. Yes, of course, you can practice during menstruation. Not all the asanas. It's very important to refrain from doing all that power yoga, vinyas yoga. So those are all very modern concepts. See, if you want to enjoy better menstrual health, and please remember, you cannot separate menstrual health from the general health. Only women who enjoys a good menstrual health she'll be enjoying the better general health. So these asanas, the Virasana, Balasana, whichever asana will be displaying on the screen, all these asana without any side effects, you can do it, without any fear during menstruation. Having said that, even otherwise, even other, days of the month, definitely you can practice, with the sustainable practice. And also the timing is very important. See, usually Ayurveda principle says, you need to practice yoga during sunrise or when the sun is setting for a maximum benefit. And also, many of them ask, how long I need to maintain. It's more important to, be aware of your breath than staying in the poses. It's important to begin with. You can start with 30 seconds and go on up to 2 minutes or 3 minutes. It depends on your convenience and the time availability. See, this is the Balasana. This is the forward bending. See, this is acting on your sympathetic nervous system. Many of us, I think women, we have gone through this kind of variations because of the hormone, fluctuation every month. See, we can encounter, anxiety, depression, or anger, irritation. Balasana is a very good, asana not only during those times, you can practice every day to see better results.
Can we have the next?
See, Upavishta Konasana and then other two asanas, Baddha Konasana and, Supta Baddha Konasana. All this, if you see, you can see the stretch of both the legs. Okay. So it is strengthening the reproductive organs. And definitely on a day-to-day basis, on a regular basis, if you start practicing all these asanas, definitely you enjoy better menstrual health. This is Shavasana. See, most of us, I think women now these days, they are working outside and inside the house. See, if you can't manage any of the asanas, at least you can do the Shavasana. All it needs is you have to lie down and be aware of your breath. If your mind wanders, just bring your attention to your breath. Your health is in your breath. So this is what you can go on Google, go to Iyengar Yoga, do your own research. If you have the belief and if you practice, regularly, definitely yoga works in a very miraculous way. I think this is the same Supta Baddha Konasana. So strengthening the reproductive organs. All these has the same effect and it improves and strengthens so that the girls or women who have a problem issues, related to their menstruation, ease the pain and aches, every month.
Thank you, Nirmala. That was marvelous. And by the way, that was Nirmala in the pictures. Okay. So Roshni, now it's time for you, and I will ask you about the Innovation Lab of the OBA of St. Joseph's Boys High School, which has turned you kids into thinkers and doers, rather than just textbook specialists. Tell us more about why you and your team chose women's menstrual health as your assignment. And what did you learn from the research you did?
So during the 11th grade in St. Joseph's, we were given the opportunity to take part in Innovation Lab, which was a project that tackled social and environmental issues. And each team was asked to pick a societal issue that we saw around us, do some in-depth research into the cause of the issue and how we can contribute to solving it. So while we initially started off by debating about issues like fast fashion and water conservation, we eventually decided to do a project on menstrual health because there were two reasons that we chose menstrual health. The first is that it's one of those topics that just cannot get enough exposure. There's always someone to reach out to help and to educate about destigmatizing menstruation and about shifting to more sustainable methods. So, and while there's been a lot of improvement in the way menstruation is talked about publicly, that's also caused new problems to arise. And the most apparent one that we saw was the use of unsustainable methods of menstrual products. So with the COVID-19 pandemic, we couldn't do as much local research as we hoped, so we had to stick to an online survey. And the result of that survey just proved our hypothesis, because according to the survey, half the people that attempted it had no idea about menstrual cups or how to use them. So we sent the survey to a large number of people within our age group, which was 13 to 18. And most of them were open to switching to sustainable methods of menstruation. They just lacked information on it. So through Innovation Lab, we aimed to bridge that gap. So to make them aware of more sustainable menstruation products and to make them as easily accessible as possible in our locality. So speaking from personal experience, I went to an all-girls school and we were not educated about menstruation until 9th grade, when most of the girls in our school had already been menstruating for over 3 years. So we realized that the starting point had to be education, and especially education in schools. And in Feb of this year, we did a webinar with Crystal House India, where we talked to the 11th grade students about menstruation. And one of the things that stood out to me from that webinar was during the question answer session, where one of the girls spoke up and said that she completely missed out on knowledge about menstruation because neither did her school talk about it, nor did her parents talk about it at home, because it was a very taboo topic at home. So we realized that if schools did have proper education about menstruation, it would ease the burden off because it's such a taboo topic in so many households. So I think that was the main thing that we realized from our research during Innovation Lab, that education had to start at the school level. And the second thing that we realized was, due to the COVID-19 pandemic, because so many girls were missing out on going to school, they were also missing out on menstrual products, because a lot of schools did supply those menstrual products, especially people below the poverty line who couldn't afford them. So those were our two agendas through Innovation Lab, to
Thank you.
educate girls as well as to make it sustainable for them.
Thank you, Roshni. And now it's Wahaj's turn. It's so interesting to have a man on this discussion. Was it taboo in your family circles discussing menstruation?
Good evening, everybody. I'm Wahaj Hassan, currently studying in the 12th grade of St. Joseph's. So to answer your question, ma'am, no, in my family circles, there hasn't been this idea of menstruation being a taboo thing. Everyone was open about it. In fact, when we came up with this problem and I had to look for some help, my family was nothing but supportive. They helped out with expanding our ideas, and the surveys that we did make, they helped us publicize it and the whole project itself. So that way is a pretty supportive experience.
Yeah, and then what happens about school? Did you have any negative snickers from your peers, your other friends, that you, boy, was something like this?
Not at all, actually. My friends were really supportive. None of my peers made fun of or anything of the sort. Instead, they were super encouraging. Peer pressure in this context, I feel, was mostly an issue of the previous generations. That way, I feel like our generations are the ones that have, become a little more sensitive, open, and educated about this topic. And for most of us, it was self-taught through either social media or just more open conversation with each other, without the unnecessary aspect of shame that used to be attached to it.
Yeah, that's wonderful. What's wonderful for us to know that this generation, your generation, is opening up. So it's going to be so much easier for us women. And
right.
I'd like to go on to your innovation lab, which was extrapolating this into an enterprise. Can you quickly just let us know what you have planned with an enterprise?
All right. So first of all, our project, the Innovation Lab, started with the problem of availability of these menstrual hygiene products, and that, of course, calls for its sustainability. We found some sustainable alternatives and how to acquire them, and we look forward to put this and the rest of our research into practice. Our plan was to help women be able to access these sustainable products conveniently. After Innovation Lab ended, Roshni got in contact with the organizers, who were more than willing to help us in our endeavor. They helped us establish an advisory board, and with their help, we'll be focusing on target areas in Bangalore, where we will be educating and helping in the supply of sustainable menstrual products, along with its disposal. We even reached out to Dr. Bharath, who was more than willing to help us teach a team of teenagers to educate the young girls and women about the reality of menstruation, which is to remove the taboo from it, and also taking care of it and the sustainable ways of doing it, along with the disposal of the products. We also look to speak to our local supermarkets about including menstrual cups and cloth pads in their stock, as we did notice a lack of it, surprisingly. Our plan also includes setting up a presence on social media and really driving forward the idea of switching to menstrual cups and cloth pads and supporting the supply of it to underprivileged crowds. We've also got contacts with a few vendors, and we'll be setting up or partnering up with platforms where consumers can buy these menstrual cups or cloth pads, and the royalties of which will be going to this cause.
That's wonderful. This generation seems to really have their ideas in place. They have plans ahead. It's good for generation to realize that. And so with this, we come to the end of our discussion. And I hope you all have enjoyed it as much as we have. And so now I give the over to Reena. She will take questions. The floor is open for your questions in the chat box. Reena will take your questions from now.
Thank you, Marianne. And though we've had a couple of discussions on the chat box, would like to reiterate some of the questions. But before that, thank you to all the panelists who have shared their views here. It was extremely enlightening, and a special, round of applause and cheers to our two young panelists, Roshni and Wahaj. Yeah, I can see people clapping over the screen. Extremely enlightening and confident for people of your age. And thanks for sharing it so clearly. So we have Samantha Pasha who did ask why would the use of menstrual cups would not be possible younger than 18, Doctor?
It's not a question that younger than 18 cannot use it. Yes, they can. But like I always say, let the mother use it first. And if the mother is then confident that the child is aware of the parts of her body, because she needs to know where the vagina is, because it's an intravaginal insertion. So if this, which way do I see it? Yeah, you can see it now. This is the vagina. This is the uterus, this is the tube, and this is the ovary. Now, women have 3 openings down below, while men have 2 openings. The third opening for us is the opening of the vagina. And you need to know it, and you need to be able to insert it inside. You need to be able to pinch and remove it. So it requires you to know your anatomy. Now, your mother, if she can explain to you your anatomy and you are confident of putting it inside, then you could be 16, you could be 15. I have my friend whose 12-year-old daughter, because she does gymnastics, took up to it because she didn't want to miss her gymnastic classes. So it all, but her mother is the user. Is a user. So it depends upon what sort of confidence your mother can give you, what sort of hand holding your mother can do, and what sort of knowledge of your urinary and genital parts that you have. Lots of us don't even know we have 3 openings down under. So it requires somebody to be able to guide you through it. So yes, 18 years and younger. But why do I say 18 years? Because at 18, you're an adult. You can make an adult choice. When you choose to be a doctor, an architect, an engineer, you can choose to use the menstrual cup too. Nobody can then turn around and say, you're not adult enough to use it. You're already an adult. Have I answered your question?
Samantha, are you still there? Could you mention if that's an adequate answer? We'd like to have an interaction.
Yes,
Then
thank you. Thank you, doctor. I was asking for my daughter, and you said the mother should use it first. Mother has menopaused. But that's fine. I will explain everything to her. And thank you very much for the answer.
Correct. So what happened to you and me is we missed out on this wonderful thing. But it doesn't mean that we don't tell the younger people who are fortunate to be menstruating to use this. So I'll be happy to help you if you need any help.
Okay, thank you. Lima, I'm taking your question next. Feel free to unmute and add to what I ask if needed. The question is, ma'am, I used 25 to 30 pads due to heavy bleeding. This is a common question. I've got fibroid. I'm really struggling. Your answer, doctor?
So the question is that if you're bleeding heavily and if your hemoglobin is falling, that is when you really say that you're bleeding heavily. But otherwise, if you use the cup, you will realize, like I told you, that you're only bleeding 60 ml, and this cup holds anything between 20 and 25 ml. So really, during the day, you will find that you may need to change this. On a heavy day, you may need to remove this cup maybe 3 times or 4 times a day. But 25 pads, girl, you must use this. Then you will be so happy that you are not spending so much of money, you're not creating so much of trash, and that you are so comfortable. When you're wearing the cup, you don't even feel the wetness. Otherwise, when you're bleeding and using 25 pads, you would be constantly feeling the blood coming down and, feeling wet, because the pad does make you feel wet, right? The pad can only hold 5 ml. This can hold 15 plus ml, which means that it is that much more capacity than your disposable sanitary napkin. So if you are 18 or 20 and plus or married, then you must use this. But if you are having a fibroid and that is what is producing your heavy bleeding, please go to the gynac, check it out. If you can do something, you should not become anemic during your periods. That is most important, because if you become anemic, it means that so many things, you won't be able to run, you'll be breathless, so many things will happen to you. Your hair can start falling. All that happens to you when you are anemic. So your hemoglobin should not be less than 10 grams.
Thank you, Doctor. We have a question from Dr. Maya Mascarenas. The question here is, many complain of pain when used through the night. What can they do to reduce the discomfort?
Hi, Meenakshi. I'm just saying that many of them, they say because it's about 8 hours or maybe even a little more, that they put it on and then they remove it. They don't remove midday, middle of the night. So if they feel it and there's a kind of not so much pain as a discomfort, so what can they do? And if it's a different kind of cup, what are the kind of cups that they can use instead?
So it totally depends upon you. You have to get used to it. The first time I wore it, for the first few minutes, I felt it. But after that, I didn't feel it at all. It's like the contact lens that you wear. The first time that you wear it, your hands are shaking, you don't know, you're worried that you will touch your eyes, all that happens. Then what happens is you slowly get used to it, and then you get totally comfortable. Now, if the cup is actually you're feeling the cup, then there are 3 varieties of cups: the soft cup, the medium cup, and the hard cup. If you're wearing the hard cup, then you need to change to the medium or then come down to the soft. So young girls and women plus 40 need to use the soft cup, because they're not yet used to it. And plus 40, you need the soft cup because you have not done any exercise and therefore your muscles are not strong. The athlete needs to use the hard cup because your muscles are so strong that it will make it crumble, the cup, and then it would leak. So the vagina has to expand, and the vagina has to have an equal and opposite reaction to produce a seal with the cup. So once the cup is inside, you will truly not have any problems, but you need to get used to it.
Thank you, Doctor. Here's a related question from Mary Kuti. I'm jumping the sequence here, but it's related. Mary Kuti has asked, what is the material used for making the cup? And Mary would be happy to see on screen as well.
So cups are made from silicone, but there are medical grade silicone and food grade silicone. The cups that are cheaper are food grade silicone, and that's not okay. You need to use the platinum cured medical grade silicone. Now you will not, if you need a heart stent, you're not going to tell the doctor, let me use the cheaper variety. I will use the one because it's going to stay there in my arteries for a very long time. This cup you're going to use for 10 years. So which is why I said, don't stinge on it. Buy a good quality cup which is made of medical grade silicone and made in India. Don't buy the ones that come from across different countries where it is cheaper. So there are lots, if you go on to the Amazon or whatever websites, you will find lots of cups. But look for something that is made in India. Look for something that is made of medical grade silicone, platinum cured medical grade silicone, and then buy it. Because this is going to be a one-time purchase which will last you 8 to 10 years.
Thank you, Doctor. We have a question from Pamela. How do you know when the cup is full and needs to be emptied?
So unlike the pad that you can see that is stained, the cup you will not know that it is full. Google and all have not yet come up with a little device inside which sensor which says that the cup is getting full. So what do? You know when you will change this pad after 4 hours. So in the learning phase, use it because the capacity of this is 5 ml. and the capacity of the cup is 15 plus ml. So take it out after 4 to 6 hours and see how much the cup is full. If the cup is only full up till here, less than half, then you know that you can go for a little longer time. So this is something that you need to try titrate. I can't tell you. It's like, how much salt do you put in your sabji? You are the one who is going to tell it. I can't tell you. You know, even though I may be Sanjeev Kapoor, I can't say. So Sanjeev Kapoor will also say, depending upon your taste. So depending upon your, bleeding, you will be able to figure it out. 4 to 6 to 8 to 10, but once in 12 hours, you must remove it. Remember that the blood that is filling inside here will not come out. And if the cup is really full, then what will happen is the serums, the clear liquid will start leaking out. Then you know that, yes, you have forgotten to remove the cup in time. Then remove it and see how much it has filled, and then you'll be able to do. So if the cup has not opened up fully and the seal with the vagina hasn't formed nicely because the vagina is flat, when you put in the cup, the vagina expands and forms a seal. The vaginal wall forms the seal, not the cervix. So the vaginal wall forms the seal, and then when you want to remove it, you have to press the cup. So put one finger inside and press down, and then the seal will be released, and then you can pull it out. So all this experimentation during the learning phase must happen in the bath area of your bathroom, because then the blood will, even if it spills, will not make a mess.
Thank you, Doctor. We move on to another question from a young girl, Viola Narona. Her question is the cup still a viable option if you have a very low cervix?
Now, this low cervix is something that I never understood. Remember, a lot of us gynecologists didn't come in to talk about the menstrual cup in the early phases. Now, in India, the cup has been there for 20, 30 years around the world. But in India, the cup has started coming in over 12 years. And at the first time that it came in, people said, put your finger inside and see how high or how low the cervix is. Now tell me, all of us doctors didn't learn what the cervix is the first time we put our finger inside. It's not something, I could have felt this side and think that the cervix is there. I could have felt this bone and said that that is the cervix. We take years of experience before we figure out which is actually the cervix. So your cervix normally will be 3 inches above. The cup is 2 inches. So your cervix will not be down below. The fact that the prolapse of the uterus does not happen to young girls and women. It happens when I am 63-year-old like me, or I'm going to be 73 when my muscles become weak, when my ligaments become weak, then the uterus can come down. But till then, it doesn't happen. The cervix is in the right place. Your nose is in the right place. Your cervix is in the right place. So stop worrying about the cervix. Use the cup without worrying about this. Don't even bother to put your finger inside and feel how high your cervix is. Your vagina is 3 inches long and this is 2 inches long. If you have a cup with a stem, make sure that the stem doesn't peep out from outside the vagina. Can you see the stem now? Yes, I think you can see the stem. So you have to cut the stem to the right end, and the stem is only for you to find your cup. That's why this cup, which was designed by women, they removed the stem, because then you don't have any temptation to pull the stem to pull it out. You have to press here, and once you have pressed here, then the seal is removed and then you can pull it out. So it's very important to understand how to put it in and how to pull it out. And how do you put it in? This looks very large. My God, this looks like a nimbu. How can I put this big thing inside my vagina? So what do? you reduce the diameter of the insertion and now make it the size of a groundnut, and then apply a lubricant. Your blood is the normal lubricant. So if you are just starting your periods, there may not be enough blood here. Or if you are in the learning phase, apply coconut oil or apply Vaseline on this so that this will slide inside easily. Okay, once it slides inside easy, let it go and it'll open up. And sometimes you can hear the plop. But if you don't hear the plop, don't think that your cup has not opened. If you are not leaking in the next 2 hours, it means that the cup has opened. So this forms a beautiful seal and will not allow any blood to come out because the vagina has circled the cup, the rim of the cup.
Thank you, doctor. That was a good explanation on that front. And we have a question from Pamela. So, how do you plan to reach out to trans men who have a uterus? They would require these products and this education, but you would not be able to reach out to them at centers for women.
I haven't been able to reach out to trans men, but if somebody will reach us to them, we will be happy to explain to them, we'll be happy to gift it to them, we'll be happy to have them purchase it at a good price so that they will also have the comfort of using this. And it's very important for them to use it too, because they definitely have a vagina and that vagina can hold this cup very nicely. So if through your circles you can reach the trans men or give us a way to reach them, we'd be happy to educate them too.
Thank you, doctor. This question is for Nirmala. We have a question from Shanti. What is the best time to do the asanas that we saw on screen?
No, I think I mentioned that when the to Ayurveda principles, when the sun is rising or when the sun is setting, to get the maximum benefit out of whatever you're doing. So that is the ideal time.
Is there any question to Roshni, Wahaj, Shilpa, any of the other panelists here from any of us? You may continue to ask it on the chat box. And here's once again a reminder that through the donations that you may send, so the details are mentioned in the chat box, and you will receive a receipt for your donations. It's going into rural areas and to purchase menstrual cups and cloth napkins for the underprivileged. So with this, really, it has been a lively and engaging session. So you may still put me your questions. And while the session ends here, the journey begins towards sustainability, hygiene, and health. Reba's daughter has been listening very attentively throughout. If your name was mentioned on screen, I would have mentioned your name. Is there a question that you would like to ask? Maybe know your name?
Yes, my name is Gina.
Gina, okay. Any question to the panelists?
I was very, I'm still in 11th standard, and a lot of my friends told me that, menstrual cups are invasive and it's a little dangerous. There is a little fear that we have in using these. Today, I was really moved and I feel I can use this. And it's so nice to have so many doctors, so many people tell us about this. It's amazing. I thoroughly enjoy this and I will definitely tell my friends.
So if you want a session, Reba, all you have to do is to contact me, put all your classmates together, and we will talk to you one-on-one so that you then understand how it is to use it, and all the fears that you have in your mind will go away. There are many of us across the country and across the world who would like you people. I missed it, but I don't want you to miss it. It's such a wonderful thing. Don't you use the mobile phone? Don't you use the WhatsApp? This is another technology that you need to learn. It's as simple as that. And once you have learned it, then you will actually tell your mother, Mom, you should have told me that before.
Yes, yes, thank you so much, Doctor.
Thank you, Doctor. That was a very practical explanation. And thank you, Gina, for asking that. We had a group of Shilpa, sorry, you wanted to speak?
Yeah, I just want to reiterate on what Dr. Meenakshi Bharath just mentioned. As I mentioned, I have started using menstrual cup for the last 1 year, and the feel, as Dr. Meenakshi Bharath said, I don't fear my periods anymore. I look forward to it because it's a mess-free period for me. And my one initially when I started using the cup, whatever the small difficulties, we overcome it within the second cycle itself. We are almost proficient in enough to use the cup. But what I would like to share with you all is like I had to travel to Salem, so which is easy, 4.5 to 5 hours drive, and it was my period time, and I was using the cup. To be very honest, I reached Salem, and then I had a meeting for a couple of hours, finished my thing. Only at the end of the day did I realize, oh my God, I have my periods. I need to empty the cup and then go. That's how comfortable the cup is. So you even forget you have your period. That's the only drawback, if you have to say, because you're so comfortable, you wouldn't even realize you have a cup inside you. So yes, otherwise it's the most best choice I've ever made. One of the best choices that we have ever made is what it is. So that's my experience, which I wanted to share with you all.
Thank you. Thank you for sharing that. And while Dr. Meenakshi said she couldn't share hers and she's sharing it from the experience of the people she's recommended it to, glad to hear a first-hand experience, Shilpa. Kausar, are you there on screen? You said, you have a question. Are cloth napkins like the conventional ones? So,
No. So can I answer that?
yeah, please.
So cloth napkins, the new avatar of the cloth napkins are made of cotton. This is Cora cotton, so it's not white. It's not virgin white. It is off-white. It is a single layer of cotton, just a rectangular piece, and then you fold it into many, layers. It becomes now an 8-layer thing, and then you put it onto a jacket, which is leak-proof material. So as against 360 disposable sanitary napkins that you would use, you only have one jacket. And this cloth pad, 5 pieces of them is what is given per set. And when it gets stained, it holds the same amount of blood as a disposable sanitary napkin, 5 ml. When it gets stained and you want to change it, carry one extra in your school bag or in your college bag, fold it in like this. This side is the blood, fold it in like this, and then put it into a plastic bag or a cloth bag. It doesn't smell. Your pads don't stink. The cloth pads don't stink. Bring it back home, soak it in a mug of cold water or whatever is your tap water, and then after 15 minutes, squeeze it out. All the blood will come out. Don't soak the jacket. Soak only this. And if the jacket has any blood on it, just wipe it with a little bit of a wet cloth, and then you will be able to wash this, hang it out in the sun. The important difference between the old pads that your grandmother used to use and the ones that you are being given now is, 1, there is a jacket, 2, there is no leaking, your clothes won't stain, and 3, you are washing it without using hot water, normal water, and then you're hanging it out in the sun. And because it doesn't look like a pad, please make sure that this doesn't go to your kitchen. So you need to write your name on it, or you need to put in an embroidery, and you need to personalize it. So if you and your sister are using cloth pads, don't mix up the cloth pads. You don't mix up your panties, right? So this is the same. You must individualize it. Either put an embroidery or put your name on it, or something that you do. Be innovative. Be very individualistic. So maybe your sister knows embroidery and you know applique work, and you can put an applique piece on it and make sure any number of pieces of cloth you have in your house, just take a small piece and individualize it so that you know that this is your pad. And your mother, when she goes to bring the clothes from outside to inside, knows that, this is my daughter's pad, and so it shouldn't go into the kitchen.
Thank you. We have Pamela who wants to ask a question, and she's been writing. Pamela, please come on screen.
Okay, no, I just wanted to ask that, you all have been talking about cloth pads as well as menstrual cups. I would like to know what the benefits or rather the popularity of both. Is it the menstrual cup that is more popular? Is it more beneficial using a menstrual cup? Or is it the cloth pads one? Or is it that you can, it's better to use a cloth pad when you're at home, or a menstrual cup when you're outside? What I mean, if you could throw some light on it, Doctor, or probably Shilpa also, it would be nice. Thank you.
So it's
Take that as the
age
last
related.
question.
It's
Go ahead.
age related. From menarche to 16 or 18 years, use the cloth pad. Once you're comfortable with inserting this inside, then use the menstrual cup. So we are not telling women that use the menstrual cup only. Yes, you can use the cloth pad, but this is so much more convenient than the cloth pad. Why would you? It's like, Maruti 800 and the current cars, they all have power steering. The Maruti 800 did not have power steering. So I would use so much of strength to make the car turn. Now with the power steering, it's like this. That's it. The car has turned. So why would you use, this is for the younger child. This is for the teenager. But once you have passed your teens and reached your 20s, this is what you use. The only time you would go back to a cloth pad, and there are many varieties of cloth pads. So if you see my sari is green and red, right? So we have a website called greenthered.in. You can go to that and get all the FAQs and the advantages and the disadvantages of this. And why must I not use disposable sanitary napkins? Why must I use cloth pads? When must I use the menstrual cup? Everything is there in it. So please go there.
We have a final, Doctor, we have a final question. When you're on it itself, where can one buy the reusable cloth pads? This question is asked by Lorraine.
So you can go to the website greenthered.in and you can see the variety that is available there, and you can choose to go on to anybody's whichever cloth pad you like, whichever cost you like. These pads are called Ladli pads, and they are available for about 400 rupees. So for 400 rupees, it'll last you 36 months. So those are the best. Still, I believe that this is the best, but this is what I would recommend for donation. The rest are a little more expensive. By the time you get a set of 5, you probably spend about 1,000 rupees. But remember, 1,000 rupees divided by 3 years is 350 rupees a year, and divided by 12 is what? 12? I forgot. My brain's not divided. Okay.
Shilpa, any closing things? Since we were talking about procuring cloth napkins, once again, a reminder that with every webinar that we do, there are 200 cloth napkins that go out as to unprivileged girls. And this time it has gone to Dina Nilaya, the HIV Center in Kothnoor. Nina requests you to please screen share it at this point of time. And Shilpa, an alternate answer to what Dr. Meenakshi said on where cloth napkins can be procured. We end with that.
The cloth napkins which we procured was from Mrs. Kalacharlu. Again, she's empowering women in making these napkins, and that way even they're earning their money for making these bags. And in each bag, what we have given at Dina Nilaya, there are 2 sets of. It's not a detachable one like how it's been, but of course it has the wings. So this, like when they're using one, the other one goes for wash. Yes, it does look like a napkin itself, but yes, you have to again, personalize the entire napkin over there for yourself. So that's the kind of one which we have given. And coming to the question what she asked, where we have distributed the cloth napkins is again, we distributed at the government school and in Pulakeshi Nagar. And there again, it's a taboo to kind of insert something until they come to, if you ask me, basically we need to educate our parents, or for that matter, educate the population first that it is okay to use a cup. But if they are not really convinced, at least let's ask them to switch to a sanitary napkin, a reusable sanitary napkin. The reason being, at least that way we are not we are reducing the waste that is going into the environment. So as an alternative, till we are able to kind of convince them to use a cup without any kind of a taboo, or without any kind of a mind fogging, or without any kind of a doubt in them, let us ask them to shift to a cloth napkin. And yes, if I have a son, but what I request to all my friends who have young daughters are, start off with cloth napkins the moment they get into puberty. Because if you introduce them to sanitary napkins, yeah, that is something which is like, convenience is what it is, they think. But if you start them with a cloth napkin from the beginning, I think they already know the environmental awareness of it, the health benefits of it. So it's easy for them to shift from a cloth napkin to a menstrual cup when they pass 18, they cross 18, or even 17 for that matter. As I said, we were inspired by 17-year-olds.
Thank you, Shilpa. And these are the images that you see on screen on the cloth napkins given to Dina Nilaya. And thank you all for your contribution to this webinar. With this, over to you, Brinda, to the vote of thanks.
This webinar has been so informative and interactive. I think many of us were looking forward to it, but never quite realized it would be so good. Thank you all for your active participation. Doctor, on behalf of the Women's Commission of Bangalore and the Essential Women's Cell, I thank all the panelists who made this event so riveting and relevant. Dr. Meenakshi Bharath, your message on sustainable menstrual health was conveyed so simply and so effectively. And all the explanations we got from you have made us understand that it isn't really so complicated. We're really grateful that you responded so spontaneously to us and to our invitation to address this audience. Mrs. Nirmala Gowda Nayak, you gave us very practical ways in which young women can maintain sustainable menstrual hygiene, and your information on the yoga asanas have really been very, very interesting for us to hear and see. Thank you. Mrs. Shilpa Spoorthy, thank you for being on our panel and organizing the donation of those 200 kits. We also are very happy that you shared your experience with us, and also the experience of the young women that you work with. Now, to our young panelists, all I can say is that it was a joy to have you with us this evening and to share details of your assignment in this very pertinent subject. It was also very interesting to listen to your take on how young people think differently. And thank God for that, because we were brought up slightly differently. We might have had educated parents, but there were lots of taboos which aren't in place anymore. And we are grateful for that. I have to thank Mr. Joshua Matthew. He is the one who gave us this generous facility of the Cisco WebEx. And that is how we have been permitted to have this webinar for all of you. Now to our moderator, Dr. Marianne De Nazareth. We really are so happy to have had you with us and for doing a wonderful job. You were seamless in the way you moderated everything, and we are truly appreciative of the way it was done. We also want to thank Lorraine Fernandez and Lorna Lobo, our secretary, for working behind the scenes and for all their inputs. The Women's Commission gratefully acknowledges all the monetary help that we've received so far, and the donation from Mrs. Deborah Shea. The Women's Commission is committed to using these funds exclusively for this project, and we rely on your support to continue to impact the lives of young women and girls. A very special thank you to our young teenager, Nina, who's here and who designed the attractive poster and helped us with all the little technical challenges some of us have. And last but not the least, thank you to the enthusiastic batch of ladies from the Women's Commission and the Ascension Women's Cell for putting all this together finally. With this, we come to the end of this evening's webinar, and we hope all of you enjoyed it and have taken a lot from what we've heard. We require you all to help us to spread this important message of sustainable menstrual health to all women. Thank you, and wishing you all a safe and happy week ahead. Thank you.